Greetings. The purpose of this tutorial is to walk you through the student-directed remote simulation with the Simulation Center. A brief introduction. With the student-directed remote simulation, SDRS, students, observers, and faculty will all join using a Zoom link provided by the Sim Center. Before the sim begins, there'll be about 5 minutes to connect with the Zoom room to meet with the room navigator, who will answer any questions and ensure everyone is able to see and hear everything correctly. Each room will have a room navigator responding to the student direction. The scenario will progress based off student directions. Students will clearly state what they would like to do, such as, okay, Mr. Laker, I'm going to listen to your heart and lung sounds now. At this time, I'm going to call the provider. I'm going to call in my charge nurse now. Or let's take a look at that wound. Vitals and lung sounds will be displayed or heard when requested.
The Zoom settings for SDRS, the student who is interacting with the patient will have their mic unmuted and their video off the entire scenario. Observers will have their mic and video both off or muted during the entire scenario. If there's a charge nurse, provider, or other interactive participants, their mic will be muted until they're called on by the student interacting with the patient. Video will remain off the entire time. The room navigator will have their mic unmuted so that you can listen to any audio, and their video will be on so that you can see everything in the exam room. In order to view the exam room fully, we need to ensure that you hide your non-video participants and are in gallery view. So what you'll do is you should be in full screen. Right now you see the gallery view, but we can see the non-video participant. So what you'll do, you can verify that you're in the gallery view by clicking on the view. To hide your non-video participants, you need to go out of full screen, and then you want to click the blue box with 3 dots on someone else's video, then click Hide Non-Video Participants. Once you do that, go back to full screen, and you can see that you're still in gallery view. This is an example of what you might see during a scenario. This is just a mannequin in the exam room. Depending on the scenario, you might have a mannequin, you might have a standardized patient. There may be a standardized patient with a mannequin as a family member. Depends on what the simulation and your faculty request. As you walk in the exam room, when you introduce yourself and go to meet your patient, if you ask for the patient to verify their name and date of birth, we will pull up the patient wristband where you can verify the patient name, date of birth, their age, and any known allergies. If at some point you need to view the vitals, what you can do is say, okay, I'm going to go ahead and look at the vitals at this point, and you can see the vitals come up. And in this example, you hear the lung sound along with the vitals. Depending on what your faculty requests, you may or may not have audio with the vitals. It might just be the vitals. And it might also be that you have vitals on one side of the screen and then the exam room on the other side of the screen. If you need to examine a patient injury, you can say, okay, Mr. Laker, at this time I'm going to take a look at your foot. And then you'll see an image of either a standardized patient's foot or a mannequin, whatever it is that we need to use based off faculty direction. After looking at the bandaged foot, you might say, well, all right, Mr. Laker, I need to go ahead and take a look at that injury. I'm going to remove the wrap now. And then you'll see an image pop up with the injury. At some point, you may need to listen to the patient's heart and lung sounds, and it might look something like this.
All right, John Joe, my name is Doug. I'm your nurse today. I'm just going to be listening to your heart and lungs here real quick, all right?
Depending on the scenario and faculty request, you may see the heart and lung sounds in a few different ways. In this instance, we have our acting nurse who's listening to the heart and lung sounds, or it might be recorded as such. You say, okay, Mr. Laker, I'm going to listen to your heart sounds now. And then you'll see our acting nurse place the stethoscope in the proper place. And then you'll hear the audio come over for the heart sounds. When you say you need to listen to the lung sounds, you'll see the acting nurse move the stethoscope to the proper place and any other sounds that you might need. If there's a medication list that you need to take a look at, you can say, okay, let's take a look at your medication list real fast. And you'll see the medications pop up. If there's a lab profile that you need to see, same thing, just ask to see the lab profile and you'll see that pop up. There are many different ways that you may work through a student-directed remote simulation. Everything depends on the scenario, the situation, your faculty, and the parameters. If you have any questions, please get in contact with anyone from the simulation team. We'll be happy to help you.